Hey guys, it is Jay Campbell and Nelson Vergel with another edition of our The Real Truth Men's Health webcast. But actually today, this episode is going to be more so for the beautiful, lovely female ladies out there. And I'm really excited to be joined, of course, by Nelson and my lovely wife, Monica Diaz. But our special guest that we have with us today is Allison Woodworth from the Prime Health and Body clinic are you guys in Phoenix or Scottsdale?
Our corporate office is in Scottsdale.
Awesome, in Scottsdale. So that's Allison for everybody. So Allison, why don't you tell us a little bit about yourself? The way the show is going to go today is that Monica is going to moderate, and Nelson and Allison are going to talk a little bit about women's, well, not a little bit, a lot about women's HRT. So with that, the floor is yours, Allison. Welcome to the show.
Yay! Okay. Yay! Yeah, well, first of all, thank you so much, Nelson, Jay, and Monica, for putting this together. I'm so happy to be here. And just a little bit about me. My background is actually in family medicine, and I was trained very traditionally. And when I think back about my training, I realized, hey, the core of it was actually just match the drug to the disease. It was sort of like, okay, make your diagnoses and then, prescribe medications that are going to almost treat the symptoms of chronic diseases. So after working in family practice for several years, I just saw this pattern. Like, wow, we're not really stepping back and addressing, the real cause of these chronic illnesses. It's just writing prescriptions to cover the symptoms of chronic disease. So I just realized I kind of wanted to shift focus out of that, I would say, disease-oriented or disease-focused model and move more toward working with patients to develop healthier lifestyles, weight loss, hormonal balance, so we could move more into the field of preventative medicine, so being more proactive, preventing these chronic diseases before they start, and just helping people live their, their best and at an optimal level. So it's something that I personally become very passionate about over the past 6 years now. So it's just, I've dedicated myself to lifelong learning, and that's what's really exciting about this field. There's just so much to learn, and the more I learn, the more I can share with everyone. So I'm happy to be here and really excited.
Perfect. So that's exciting because now you get to help people be the best version of themselves rather than focusing on the disease, right?
Exactly. Yeah.
Yay! So do you mind if we get into all the questions and the layout as to how we're going to work this so that we can get started? And then if anybody has questions,
yep.
Jason, go ahead and
so sorry about that, guys. And Nelson, I want to let Nelson jump in here in a second. But if you see over on the right side, it looks like we have 3 or 4 viewers right now, and I'm sure there'll be a bunch of people jumping on. You can leave messages, and of course we encourage you to leave messages for both Allison and Nelson in this. And so it's over on the right side. You should see it just says chat. So just go ahead and feel free to leave your questions there. So Nelson, man, how are you today?
Hey guys. Hey, Allison, I'm very excited. Finally, we got now women talking about health. I mean, I know this is mostly we've been focusing on men's health, but it is time now. It is time to start expanding into helping women also reach out and get the right information about hormonal balance and aging and menopause and all that. So, Allison, tell us a little bit more about PrimeBody. You're the clinical director there, but is that a network? How does that work?
Yeah, so PrimeBody is actually a network of providers, and we're actually national across the United States in over 17 cities now. So when I had the opportunity to meet with the owners of PrimeBody, and they kind of got a feel for my passion for this field and the experience I've had, they actually asked me to help develop some of their female protocols, and I actually work closely with all physicians in the network. So I kind of have a unique opportunity to do some teaching and training and educating of all the providers that come on board with us, as well as working with patients on the clinical level.
Very cool. Very, very cool. One thing that I wanted to mention too, being a woman and aging, it seems to me like so many women become, and I don't know, I guess fearful about aging because there's so many misconceptions about what can happen to our bodies, our skin, how we look, how we feel. I mean, we're already emotional creatures, right? So aging doesn't seem to make it any better. So I'm curious, like, which hormones are important to test in women?
Yeah, well, that is a great question. And I've sort of narrowed it down into 4 core hormones that we want to focus on when we're talking about women and hormone replacement therapy. And even when I train new providers, I say, okay, let's break it down, let's make it simplified. So number 1, estrogen. And there are multiple different forms of estrogen in the body, but I'm just going to go with very, simplified basics. So estrogen, progesterone, testosterone, and also thyroid hormone. So those are the 4 core hormones that we want to focus on and test in women. Now, if you want to step back and take a look at the larger picture, the full hormonal cascade, you could also add on DHEA levels, also pregnenolone, and even cortisol levels. And that would also give a picture into the patient's adrenal functioning as well. So, very simplified 4 core hormones that mainly I'll be talking about with you today would be estrogen, progesterone, testosterone, and thyroid. So when we check these hormones, we're looking at lab work. But I always tell my patients, I'm not treating lab work. I'm not treating numbers on a piece of paper. I'm treating you. The person behind these numbers. So it's not just look at the labs, prescribed based on that. We also have to, take into account the patient's medical history. Also, I ask very detailed questions about symptoms they're having. And as we, go into further discussion about the symptoms of hormonal imbalance, a lot of them can be somewhat vague and maybe overlap. So you really have to look at, okay, the combination of symptoms plus the blood work to give you the full clinical picture and to make the appropriate recommendation for the patient.
Right. So when you have somebody, like a woman comes in and she does these tests, she does her lab work, do you go through and explain what each, like you're looking at the estrogen, you're looking at all these, these target points here, and do you explain to them what levels are normal and perhaps what's going on with them when you have their lab work, or is that something that you wait after you get them retested again?
Yeah, well, in their initial consultation, what I do in my clinic is actually have them have blood work drawn before they come to see me and fill out a medical history questionnaire. So in that first visit with them, I already know all of their symptoms, I see their blood work, and I do go through every single lab value, and I tell them, okay, yeah, here's where your estrogen's at, here's where your progesterone or testosterone is at, and some of these symptoms you're having could correlate and make sense with the blood work that I'm seeing. So I definitely kind of tie it all together for the patient in the room and definitely break it down and go hormone by hormone as a part of the initial consult. Yeah. Right,
especially because a lot of people probably are not as educated, and this is like their first visit with you, and you want to make sure that they know what they're talking, they understand what they're looking at. So I read something too the other day about synthetic hormones. Is that something that is addressed as well? Is that something that's recommended? Like, what do you think about that?
Yeah, that is a great question, and I hear that one all the time. So there is a big difference between a synthetic hormone and a hormone that is considered to be more physiologic. So the synthetic hormones, the main ones that we hear of are Premarin and Prempro. So those are both oral synthetic hormones, so taken by mouth. Now, traditionally, these were the hormones that were prescribed to postmenopausal women, so women who are no longer having periods, to deal with some of the symptoms of menopause. Well, doctors were recommending it for decades, and then in 2002, there was a study that was done, and the goal was to look at the long-term effects of these synthetic hormones in women. And doctors were thinking, well, we're going to find, it's going to reduce risks of osteoporosis, it's going to reduce risks of cardiovascular disease. These synthetic hormones are great that we've been recommending for years. And actually what was found was that women were experiencing increased rates of breast cancer, blood clots, heart attack, and stroke. And this was being on the oral forms of synthetic hormones, Premarin and Prempro. And so that just sort of shocked the medical community, and that's when doctors began telling patients, okay, you've got to stop these synthetic hormones. They're going to be harmful to your health, so you need to discontinue them, and hormones are harmful. So that's very true about synthetic hormones. But that also led to a misconception by physicians and also patients that that's true for all hormones, regardless of if they're taken by mouth or if they're made in a different way that's not the synthetic version. So oftentimes I see patients, even to this day, who will go to their doctor and they'll just pretty much tell them, no, you cannot be on hormones, they're harmful for your health, and they don't even want to get into the discussion about different options, which would not include taking them orally or in different forms that are not synthetic.
Right. Well, I mean, even the name synthetic hormone to me doesn't sound like it's a good name. I'm like, synthetic? Why would I take a synthetic hormone?
Let me ask a question real quick, if I can.
Sure.
Yeah.
Take a little step back. When you get somebody, a woman, to call you or email you guys at PrimeBody, what are the usual concerns or symptoms or quality of life issues? What brings a woman to your network? And also, second part of that question is, are these usually women that have gone through menopause or they are younger? And the difference between the two populations? That's a multi-loaded question. I'm sorry.
Yeah. Wow, Nelson. How much time do we have?
You kept on your toes.
Let's talk about the symptoms and who you know, what makes a woman reach out. And that's something I see in the field out there. Women are caregivers, are taking care of people. They're busy. They have kids. There are so many things competing for their own well-being because they're usually, you know, taking care of people. And that's the nature, and thank God for women. We would not be here.
Right.
At the same time, it takes them a while to reach out. So when they do reach out, when I guess they hit bottom, they say, I can't do this anymore, I'm too tired to even help my kids or my spouse, what are the symptoms usually?
Yeah, so in my clinic and also PrimeBody, we treat women of all ages. So I'm going to sort of break down your question maybe like per age group or decade because certain symptoms would relate more to different age groups or different hormonal imbalances. But really, I mean, any age range can be affected by hormonal deficiencies or imbalances. So women from, you know, early 20s all the way through postmenopausal, you know, 60s and beyond. So a woman, I would say, who's in like her 20s, you would think, oh, you know, her hormones should be perfectly well balanced. She's too young to even consider hormone therapy. But what I see a lot of now are women who are put on synthetic birth control pills. You know, they don't want to get pregnant, so they're put on the pill. Now, after years of being on the pill, they start having symptoms, oftentimes weight gain, they'll be tired, sex drive completely goes down. And this is a woman in her 20s and oftentimes early 30s if they're still on oral contraceptives, so birth control pills. So I think in really any age group, I think being tired, gaining weight, low sex drive, those are really the big, I would say, symptoms that drive them to call us. So the way that birth control pills do that is they actually decrease the body's production of testosterone, and not to get too technical, but they also raise sex hormone binding globulin, which is a protein that binds up testosterone. So in two different ways, it's decreasing a woman's testosterone levels. So just being on birth control in itself can affect hormonal production. And then a woman going into early 30s, mid 30s, we oftentimes see progesterone levels declining, and oftentimes also an increase in estrogen levels due to many different factors, often even environmental exposures. But regardless, that can put a woman into a state of what we call estrogen dominance. So that is when progesterone is low and estrogen levels are high. So a woman can start having a lot of symptoms, often like the PMS type symptoms that we think of: breast tenderness and swelling, moodiness, irritability, water retention, also just painful periods. So in that age group, you know, women oftentimes think, gosh, when I was in my 20s, my periods were so easy. Well, what changed? And that change can start happening as early as your early 30s. And then when women hit age 40, they actually have half the level of testosterone that was present in their 20s, even if they're on synthetic birth control pills or not. So we get calls all the time, you know, any age group, but definitely in their 40s they can have those symptoms of low testosterone. So again, being tired, difficulty building lean muscle mass, low sex drive and sexual functioning, and it even can affect memory and cognition. So that's I'd say a key time in a woman's life. Her early 40s, she really can start seeing overlap of these issues. So estrogen dominance, and then also low testosterone. And then of course, you know, the main age that most people I think associate hormone replacement therapy with would be the postmenopausal woman. So that would be, I would say, late 40s to early 50s. Most women enter that menopausal transition. So not only do they have low progesterone, and also most likely low testosterone, estrogen levels begin to drop on top of that. So then a woman can start experiencing hot flashes, night sweats, mood fluctuations, vaginal dryness, painful intercourse. So you can see really it can affect a woman from her 20s being on synthetic birth control pills all the way through, you know, the 30s, 40s, and for sure in menopause. So if it's not affecting a woman at this stage in her life, you know, at some point we can expect to see a hormonal imbalance and eventually deficiency through menopause. And then the one hormone I didn't mention yet would be thyroid. So that also can occur really at any age, especially if a woman has a family history of low thyroid. There's a condition called Hashimoto's thyroiditis, which it can be genetic, and basically that can affect you at any age. So really, women from 20 all the way through menopause we deal with, and I really feel, you know, if a woman's experiencing any of these symptoms, to just consider getting tested, because that's, you know, the first step is have your blood work done, have it reviewed by you know, a provider who's well trained in hormone therapy, and then go from there.
So Allison, it's Jay, real quick. So let me just see. How are you? Thanks thanks for coming on the show, by the way. You're doing an awesome job. This is amazing information. This is a lot of people are going to watch this. But just to see from Nelson's question to what you just said, and then you brought in thyroid, which is a perfect transition spot. I think the majority of women, and you know, I won't speak for you guys, but I think that the majority of women today, their biggest struggle is obviously with their weight, right? Body fat. So, you know, how many women, like, how would you equate to optimizing a woman's hormones, or how important is it to optimize your hormones as a woman who's seeking to reduce body fat, trim up, get more toned, all the different, you know, expressions that women use? Because I feel like, you know, and I'll speak for a man component, as Nelson and I have written, you know, eloquently in our books. Testosterone is a lipolytic hormone, so there is a thermogenic, or, you know, an increase in cellular respiration or metabolic. There's a metabolic component to it. So does it stand to reason that when women optimize their hormones, it makes it easier for them to, quote unquote, lose body fat, assuming that they do all the other things, which is obviously reduce calories and exercise?
Yeah, that's a great question, Jay. I'm glad you chimed in there. So that's absolutely right. If a woman's hormones are unbalanced, just like a man, if she's especially estrogen dominant, low testosterone, it can absolutely be difficult for her to lose fat and build lean muscle mass. And I hear that all the time. You know, women come in, they'll be exercising almost obsessively 7 days a week, eating nothing but chicken salads, like doing everything they can to try to optimize their health to lose weight, and they're just not seeing the result. And that becomes so frustrating when you feel like you are working so hard, you're doing everything that you know how to do, but it's almost like your body's working against you because your hormones aren't balanced. So absolutely, I would say giving progesterone to balance out that estrogen dominance, bringing testosterone to an optimal range in women, and women can, I would say, give them the same benefits that we do see in men. So losing fat, building lean muscle mass, also increasing energy and mood, motivation. You know, if you're exhausted and you're tired, you know, you're not going to want to go to the gym. And when you do, if you don't see benefit, you're not going to keep going. You'll just be discouraged and stop. So this is part of it too, the energy, the mood, motivation, confidence, assertiveness. So that'll get patients in the gym and then also keep them there because they're seeing benefit.
Right. Great answer. Exactly. Great answer. Just one last question to follow up with that then, just for me to statistically understand. You guys, Nelson probably knows this, of course, but what is the percentage of the female population right now, say in North America, that are actually on hormonal optimization? Or, you know, I guess what's the percentage of that group? Is it small? I would assume it's microscopic.
Well, I would say in terms of the number of women on hormone therapy in the United States, I don't know an exact figure on that, but I do know in terms of the types of patients that seek hormone replacement therapy, I've heard about 80% of them can be women who end up like seeking hormone replacement. So, and that's usually what we see in age management medicine type practices, is typically about 80% women, maybe 20% men. And that's just what I see on a clinical level. But in terms of national scale, I'm not sure the figure. I'm not sure if you know, Nelson.
No, we haven't seen numbers on that, but you know, many women, like you say, are on birth control, and that's a hormonal treatment, you know. Not the
that's a good point.
Not the type of hormonal treatment you really want. That's a balancing act, but yeah, I mean, if you count those women, obviously more than 50%, of adult women. But yeah. And Allison, one thing, and you keep mentioning obviously estrogen, progesterone, and testosterone, and we probably should explain because I don't think some women may be completely aware of the role of testosterone in women. But my concern too is there's an epidemic of low thyroid in this country that is not, people are not being diagnosed. The doctors are using TSH as a main parameter to diagnose hypothyroidism, and we know pretty well that TSH is an imperfect variable, and a lot of women and men are putting on weight, feeling tired, sluggish, have lower cognitive function due to thyroid issues. Can you explain a little bit before we go into more details on the other hormones on thyroid and the role of testosterone, both of them?
Yeah, I'll answer the question about thyroid first, because I think this is just such an important hormone. And I see patients all the time who come to the clinic and they say, I've had blood work done by my primary care doctor, and they've told me my thyroid's normal. And oftentimes they'll bring a copy of their labs, I'll look, and only the TSH is checked. And like you mentioned, that is really not, I would say, a great indication of the actual functioning of a person's thyroid. So the TSH is just the signal from your brain to your thyroid to make more thyroid hormone. It's not measuring the actual thyroid hormone levels in the body. So in addition to the TSH, we also want to be looking at free thyroid hormone levels, the free T4 and also the free T3. Now, the free T3, to me and to most providers who are in this field, is one of the most important tests that we can look at, because this is the active form of thyroid hormone in the body. So it really doesn't make sense to just look at TSH and tell a patient there's nothing wrong with their thyroid if you haven't really stepped back and looked at the full picture. Well, where are their active, where are their free hormone levels, and especially the free T3? So in my clinic and all of PrimeBody's clinics, we do a more detailed panel, and oftentimes I will find that there is an issue with the patient's thyroid. One thing we can add on is we can test for antibody levels, so we can determine, does a patient actually have this form of low thyroid that's almost an autoimmune condition. There are antibodies where the body's attacking the thyroid gland, so we can check antibody levels, the free hormone levels, and just get a better understanding of how the thyroid's functioning. But you're absolutely right, just the TSH test is really not giving you the full picture. And I would say I encounter patients all the time where a thyroid disorder has been missed for years.
Yeah, and the role of testosterone, can you expand on that?
Oh, yeah. Yeah, so testosterone, it's very important in women. It plays a big role in sexual functioning as well as desire. Also, it can impact, like I mentioned before, development of lean muscle mass, and also energy levels, and there's even newer research showing it plays a role in memory and cognitive functioning. So the importance of testosterone in women really can't be overstated. And I think traditionally we think of, okay, testosterone is just a hormone for men, and we really don't hear a lot about its role in women, but as I just mentioned, it is so important for all of those reasons. And again, I'll say when a woman's 40, her level of testosterone is half that when she was 20. So with time, we really see a decline in levels, and that can have a big impact on a woman's sex drive, functioning, all the other areas I mentioned, and really impact quality of life. So we really do need to look at testosterone as well.
So question for you with respect to testosterone, because men, the way men administer and deal and have testosterone replacement therapy is different than women, right?
Yes, absolutely. So women need such low doses of testosterone that typically the way providers replace it is just in very low daily doses, which is very similar to the way the body would naturally produce testosterone. So we don't give them a once weekly injection, and I definitely don't recommend pellet insertions. I don't know if you've heard of hormonal pellets.
Honestly, I had a friend that did that, and we were shocked because she was explaining to us what was going on and the pain that she was having from those. And we were, Yeah. So go ahead, keep explaining.
Yeah. So I mean, I just wanted to mention, like, there's so many different ways we can give testosterone, but a pellet, in my opinion, is not a great way to replace hormones in women, especially if you think of it. There's a patient that's most likely naive to hormone therapy. They've never been on testosterone therapy. Right. You don't really know what dose is going to be ideal for them. Why would you surgically implant a hormone into a patient's body where you cannot decrease the dose, you cannot increase it without doing another surgical procedure? You know, you can leave scar tissue at the implantation site, which
infection.
Yeah, risk of infection, risk of scar tissue, fibrosis, even a pellet extruding. The other issue I saw with pellets, because I do have personal experience inserting pellets into patients, I hate to say it, in a former life years ago, when I worked in a family practice years ago, they were really pushing pellets. And so I gave those to my patients. I did it maybe 6 months to a year, and then just did not see very good outcomes, because if you give them too much, they have side effects. Well, what are you going to do? So just hang in there. It'll be gone in about 3 to 4 months. Just, you know, stay strong. The other issue is we see peak levels at 1 month, and patients may have too much, and they may have side effects, and then you see basically a decline over the next 3 months, and then levels are low again before we reinsert. So you get this significant peak and trough over time. It's not really balancing a woman's levels in a way that would resemble the way the body naturally produces testosterone. So the way most prescribers are giving testosterone to women would be in low daily doses in the form of a topical cream is the most common that we're seeing. So basically you just put the cream on, usually once a day, and it absorbs into the bloodstream that way. So it doesn't involve an injection, and the way we're able to do this is because we need such lower doses than men. So topical does work very well for women.
Right. And how about the other hormones? How are those typically replaced?
So estrogen, if a woman needs estrogen, and that would most likely be the last hormone she needs, but if she needs estrogen, that's also given in topical form. The reason we don't want to give you know, pills of estrogen and testosterone is because that would pass through the GI tract. There's something called the first pass effect in the liver, which is where actually the liver has to metabolize these hormones, and it can decrease the availability of the hormones in the system and also put a little bit of strain on the liver over time. So we don't want to give these hormones orally. Also, giving estrogen as a pill can increase those risks of blood clot, heart attack, and stroke. So that's just a risk associated with oral estrogen. It can still be given if a provider really carefully analyzes a patient's risk for cardiovascular disease, but just in general, transdermal or topical forms are safer. So estrogen, testosterone are usually always given transdermally through the skin. And then thyroid is actually given orally. It's given by mouth, usually in the morning on an empty stomach. You have to make sure to separate it from any other supplements, any food, anything by at least 30 minutes to an hour, or absorption can be significantly reduced. So that's one thing to know about thyroid. It works very well taken orally, but you have to be careful not to take it with any other supplements or food or anything. Now, progesterone can either be given as a topical cream or orally by mouth. So that one is safe to take by mouth. And if you use progesterone topically, you really don't see the full benefits in terms of help with sleep and stabilizing mood as if you take it orally. So most providers would recommend an oral form of progesterone, especially if there's any underlying issues with sleep disturbance or mood instability. So you can see there's a lot of different, you know, ways of taking the hormones just based on which hormone we're talking about. So unfortunately, we can't put them all in a pill and just take it once a day. That would just be too easy.
It's always going to be more complicated for the women, right?
Yeah. But one thing I do, if a woman needs both testosterone and estrogen, once she's balanced on both hormones, I can actually combine them into one cream. So she's not having to apply 2 creams and, you know, all these different things. You can combine it once they're stabilized on the doses of each hormone.
You know, these creams, they come, I'm sorry, do these creams come from where? Are they from Walgreens, CVS, or made by compounding? Are they special?
Yeah, that's a great question. So all of the hormones that I've been mentioning, I usually will send those prescriptions to a compounding pharmacy. So they're a very important partner for a provider like myself who, really specializes in hormone replacement therapy. We can't just use a Walgreens or a CVS because they have very standardized doses and standard medications that they carry on the shelf. And if your patient, needs a specific dose or a different route of application, they're not flexible with their formulas. A compounding pharmacy, they can actually make any I would say prescription that a provider needs for their patient in any dose. So when I write a prescription for Monica Diaz, let's say, basically they are going to make this prescription fresh for her right when they receive the prescription. It's not something that's been sitting on the shelf for a year that every other patient is on. So it really can be customized to the individual patient, and compounding pharmacies are able to do that for us. So it's really just I'd say a powerful partner that we have to give our patients the individualized care that they need, because everyone's body is different. There's not one standard dose that works for everyone. So a compounding pharmacy is definitely the way to go when you're dealing with hormone therapy.
Yep, VIP service, right?
Yeah, exactly.
Exactly. So out of curiosity, in speaking with, how these hormones are delivered and how we deal with them, like as far as side effects, are there any side effects that people should know about or pay attention to when they're dealing with hormone replacement therapy?
Yeah, that's a very good question. So that's part of my initial consultation when I'm making recommendation to a patient about which particular hormones I'm prescribing. So with any medication, there are potential side effects. In the case of hormone replacement therapy, I would say side effects are usually more dose dependent. So if a patient is on, let's say, too high of a dose of a particular hormone, or they're not balanced right, they could see some side effects. So I'll just mention a few of the big ones. So with testosterone, women can notice a little bit of acne, increase in hair growth if they're on too high of a dose. And obviously, I like to educate patients about this. So if they have these issues, they tell me, we can decrease their dose and the side effects go away. Now, with thyroid, if you're on too high of a dose, this is not very common, but they could have issues with an increase in heart rate, so a little bit of heart palpitations. They could have a little tremor, trouble sleeping if they're just on too much thyroid hormone, especially because the type of thyroid that we prescribe typically has T3, which is the active form of thyroid in it. So if it's a little too high, they may have some of those issues. Decreasing the dose should resolve it. And then estrogen, I would say in general, we're very careful with the amount of estrogen we give to women. And like I mentioned, typically we would replace, progesterone first, testosterone, and a portion of testosterone will actually convert over to estradiol or estrogen. So we're finding we can use lower doses of estrogen than we have in the past, and women are still noticing great results in terms of resolution of their symptoms of low testosterone and also improvement in their symptoms due to low estrogen. So if a woman's on too much estrogen, there would be concern that she would have overstimulation of her breast tissue or her uterine lining, and that could cause issues with breakthrough bleeding and spotting. And postmenopausal woman, her period's done, we don't necessarily want to bring that back. That would not be so positive. So yeah. Right. So those are just some of the potential side effects that I would go through with a patient at their consultation, make sure they're aware of them. And again, that they know it's usually dose dependent. So it could mean they're on too much. Backing off on the dose, they will resolve.
Mm-hmm. How about emotionally? Are there any symptoms that someone should pay attention to with respect to their emotions about what's going on with them? Anything like that? Like, would they be more sad, more in depressed states? Anything that we should know about in that respect?
In terms of emotional changes, I would say typically like progesterone would stabilize and improve someone's mood, so they may notice that. They just feel a little more calm, a little more, mood has been stabilized. It also improves, the PMS type symptoms and moodiness, irritability. With thyroid, it can actually improve mood and depression, so you'd see a benefit there. With testosterone, if you're on much too high of a dose, just like with men, a woman could feel like she's becoming possibly a little irritable or possible aggressiveness if it's much too high of a dose. But usually she would have those other symptoms first, like a little acne. We decrease it, so it shouldn't necessarily affect mood. But usually I would say we see more positives in terms of mood changes, which is a really real benefit of therapy.
Right. Awesome.
Pregnancy category X issue. You mentioned, we were discussing that back a few weeks ago.
Yes. So that's a great point to bring up. So with testosterone, it is considered to be pregnancy category X. So that just means that if a woman if she's on hormone replacement therapy and were to become pregnant, we definitely know there is risk of causing fetal harm. So before a provider would give a woman testosterone, they need to be talking about, okay, what is your reliable form of birth control? Have you had a tubal ligation, or do you have an IUD in place? I mean, hopefully it would be a form of birth control that doesn't involve synthetic hormones or contraceptives. But that is a discussion that needs to be held between the patient and provider, because you would not want to start testosterone if you're a premenopausal woman and not on birth control, because there would be real concern there.
Right. Now, one thing that I wanted to ask as well, which it piqued my interest, because Nelson posted an article about people, hormone replacement therapy, and then people making changes to their diet, and how diet plays an impact on hormone replacement therapy. Can you elaborate a little bit on that? Because sometimes what happens, what I've noticed with women, is we have our habits, right? We're accustomed to eating emotionally or whatever this is. And so when we get hormone replacement therapy, sometimes we tend to think, oh, well, this is going to fix that. Oh, and I'm not losing weight or whatever it is. So what kind of a conversation would you have with a woman with respect to their diet, their lifestyle choices, and working together with hormone replacement therapy so we can benefit the most from it?
Yeah, that's a great question as well. So it's so true. There's not just one magic pill or cream that's going to solve all of our problems. So, and especially I have a lot of women who come to me, and weight is a big concern of theirs. That's oftentimes, one of the main reasons that they're coming in. So just balancing hormones is one really important step, but then lifestyle absolutely has to go along with that, like you said. Regular exercise is very important. A mixture of not just cardio training, but also weight training to build lean muscle mass is important. And I think a lot of women have the misconception that more cardio and running is better for you. And I had that misconception. What's that?
Cardio queens.
Yeah, and I was the same way when I was younger. All I would do, I would run and run and run, and I would run half marathons, and that's all I would do. And I never lifted a weight. And then I did some reading, and I realized, oh no, women, we actually should be doing some weight training as well. We want to develop and build that lean muscle mass. And when I say lean muscle mass, that's the key point there. You're not going to look bulky and big and huge. You're just going to develop that nice lean muscle mass. It's going to actually increase the amount of calories you burn, your basal metabolic rate, just sitting there, because you have more muscle as opposed to fat. So building lean muscle mass is very important. You can keep that toned look and also build that muscle mass without having to have that concern. So a little cardio, good, but then also you want to do some weight training. And then in terms of diet, I would say if I had to mention some just basic recommendations, something along the lines I would say of a Mediterranean type diet would be a good recommendation. So that's basically just plant-based diet, fresh fruits and vegetables, legumes, nuts, whole grains, fish, olive oil, occasionally I would say chicken, eggs. You want to have a good amount of protein, but then rarely red meat. So following that diet, it actually was found that it reduces the risk of heart disease by up to 47% over a 10-year period. So that was actually a study published in the American College of Cardiology in 2015. So just seeing that, if I'm going to make some basic recommendations, I would say, fresh fruits and vegetables, lean meats, chicken, turkey, fish, rarely red meat. But then just making those simple changes can actually reduce your risk of heart disease by almost half, which is incredible.
Right.
Breakfast is very important, and a lot of women are rushing with their kids and don't eat a good breakfast, right?
Exactly. Yeah. Right. And the other thing that I've heard time and time again from other women is many women believe that after you have children, it's very difficult to obtain a great physique or to be in your optimal shape, because having kids just ruins your body. So, I mean, is there anything that you can say with respect to that, and then maybe even with hormone replacement therapy, how putting that all together? Because, I mean, honestly, what I've noticed is I'm in better shape now than even before I had kids. Of course, I have like excess skin in some areas and some other issues, but I honestly feel better, and I feel like I look better than before I had kids. So is there something that, you know, you can like let other women know like about that, about having kids and it not being the end all be all?
Yeah, that's a great point, because I think after having children, a lot of women sort of shift their focus. You know, as you need to. You're a caretaker now. You have a child, you know, as your main concern, but you cannot neglect yourself and your own health. So I'd say, even though, yes, like, you know, you are the caretaker, you're a mother, your children are, you know, your top priority, you can't lose sight of your own health and wellness, because you have to take care of yourself if you're going to be there for your children. So that's a good point. You know, don't just think, okay, everything's over, I've had a kid, it's, you know, it's the end of the world, I'm fighting a losing battle here. No, just know that, you know, your health is important. You know, need to take time to actually exercise. You know, take the time to, you know, make healthier choices. You know, so it's not just everything's, you know, I would say too late if you've had kids. That's a very important time. And I didn't know you before you had children, but you do look amazing. You look great. I think you're a good example of that. It's like, it doesn't have to be over. You're just starting. So.
Exactly, especially if you pay attention. And I think the great part about this whole show is that it's more or less the individual knowing their own body and paying attention to what's going on. Because many times we'll go through our days and we just react. We just live. We live off a default. Things are happening and then we react. Things are happening and we react. And if you go to someone like yourself and you're like, okay, wait a second. I want to make sure that I know what's going on with my body. Help me be the best that I can possibly be. And that's what this is basically about. Hormone replacement therapy is just making sure that we're living optimally, right?
Yeah, absolutely. It's just bringing your hormones into an upper end of a normal range, so to an optimal range, so your body can just function at its best. That's, I think, the simplest way I can think to explain it. We're not trying to give you super physiologic doses of hormones. You know, we're not trying to turn people into the Incredible Hulk or change their, you know, anatomy. It's just we want to give them an optimal level of hormones so the body can just function at its best, in conjunction, of course, with diet and exercise, lifestyle changes, so people just are their healthiest and they have a good quality of life.
Right. When my mom was alive, one thing that I remember her saying time and time again was, and I would love to hear your input on this, is, and I know a lot of people think this way, is, oh no, I want to do this naturally. I don't want to take anything. What would you say to somebody like that who is thinking that they want to stay natural, especially living in the environment that we currently live in?
Yeah, and that's difficult because there are a lot of things in even our environment now that can disrupt our hormones. Right. So I tell patients, even if you try to avoid, oh, I was going to say drinking out of plastic water bottles. But it's you know, if you try to avoid these endocrine disruptors, and you know, the CDC's published reports that there truly are endocrine disruptors in our environment. Drinking out of plastic water bottles, PCAs, especially heating things up in a microwave in plastic containers. There's even that.
Hold on, we're having a little echo.
Yeah, I just heard that.
It's just your sexy voice, Allison. It's okay. It's all the sexiness vibe going on.
We're back to normal, right? Yeah.
Is it still there, or is it gone?
Yeah, it's good. It's good. Yeah, it was just a little echo for a second.
Woo, go for it.
So yeah, I mean, it's true. You want to just do everything you can, but we cannot live in a cave. We can't isolate ourselves from the environment. And like I was saying, the CDC's even published reports that there are endocrine disruptors even in our air and in our water. So it's not like we can isolate ourselves and avoid hormonal imbalance just living in the society that we live in now. I would say you want to do your best to do it naturally, but then also just replacing hormones in a very physiologic way, which matches very similarly the way your body naturally produces them, and just replacing these hormones that would already be present to levels where they should be if the body was making an optimal amount. It's not like we're doing anything that is, I would say, not physiologic. It's just restoring these hormone levels to their optimal range so you can do your part, you know, avoiding the environmental exposures, living a healthy, you know, lifestyle, exercising, diet, so it can all work for you. Like I mentioned before, if hormones are out of balance, it can be very difficult to, you know, maintain an ideal weight, to lose fat, building muscle mass. It's almost like you're doing all you can, but it's almost like fighting a losing battle because internally you don't have that hormonal balance to really see the benefit from what you're doing.
Right, which is why we have a lot of women, especially as they age. And I remember Jay and I having a conversation about this as well. And I believe this is as a result of the thyroid, is that many women, as they age, their thyroid malfunctions, and they'll do all these, you know, these training, these workout regimens, and they don't see any results because their thyroid is not functioning, right?
Right, it can be thyroid, yeah. And of course, I'd look at testosterone too. There's a lot you can look at, but thyroid is a big one, testosterone's a big one, and making sure there's a good balance of estrogen and progesterone, that a woman's not estrogen dominant.
Right.
How
right.
about,
Go ahead.
Ask, any suggestions on supplements, Allison, for women?
Yeah, sure, yeah. So I feel very strongly that if we're going to be recommending supplements, we should actually test levels and see what a patient is deficient in. So in my personal clinic, I do a test called, it's a SpectraCell micronutrient test, and I don't know if you've heard of it, but it's actually testing for intracellular micronutrient deficiency. So it tests over 35 micronutrients. It's looking at vitamins, minerals, amino acids, fatty acids, antioxidants. It gives you an antioxidant function score, even an immune system score. And it's looking at these inside of the white blood cells. It's intracellular. So it's a lot more accurate than just doing a one-time serum test. So if someone's asking me about supplements, and I've had patients come in, they have a table full of supplements. I'm like, okay, well, how did you know you needed all of those? Number one, it's pretty expensive to be buying all of those. And also, have you been tested to make sure that you're absorbing them and that you're on the right doses? So I would say, you know, going to just like High Health or GNC and picking up supplements, I mean, are they going to be harmful? No. Are they going to be, you know, containing active ingredients? Are they, you know, tested for purity and potency? And are you going to absorb it? And is it actually going to you know, translate into absorption and get intracellularly? That would be a different question. So in a patient like that, I'd say, well, let's just test your SpectraCell micronutrient test and just see where you're at. And oftentimes they're still deficient in so many areas that they're shocked because they thought they were taking every supplement to address it. So I think, you know, with recommending, we need to have accurate testing. That's just the one that I use in my clinic, which I found to be very helpful. It gives patients a detailed breakdown of, you know, are they borderline, are they deficient, or are they, you know, adequate in each of the nutrients, and it'll even make recommendations on dietary changes that can give them more of those nutrients, and even supplement dosing protocols for patients if they're deficient. And then after 4 to 6 months, you retest, and you can see where those levels are and make sure everything's optimal. So it's very similar to prescribing hormones. I wouldn't just have a patient come in and say, okay, well, based on your symptoms, here's what I recommend. I would need to see blood work to back up that recommendation, and then that way you can retest and just see, are you absorbing, and you know, what was your actual response to therapy? Of course, taking symptoms into account on the hormonal side, but supplements, I think testing is just, you know, cannot be overstated, the importance of that.
Right. That's awesome. Now, I have a question with respect to your clinic, opposed to, like, say, somebody's provider. Like, what is the difference, and is it something that you would recommend going to someone who specializes more like your clinic versus their primary care physician? Because from my experience, the primary care physician that we go to doesn't know anything about hormone replacement therapy. So what's your insight on that?
Yeah, I would say that every provider is going to be different, and just like you, I found oftentimes a primary care provider just doesn't have a lot of detailed training outside of just traditional, you know, Western medicine, like synthetic hormones and the Women's Health Initiative study, you shouldn't be on hormones, and that's about it. You know, they're good with birth control, synthetic hormones. But in terms of knowing about how to prescribe more, you know, physiologic hormones through compounding pharmacies, that takes a lot of extra training. It's not something that we're even taught in school. It's, you know, even myself, I'd always been curious about it, but wasn't taught anything about it at all. You know, after graduating, I realized there's a big need for it, so I had to do, you know, continuing education just to learn how to work with these hormones. So even an endocrinologist, they are typically thought of as a hormone specialist, but oftentimes even with thyroid, they're still, you know, just testing TSH, total T4. They're only prescribing synthetic T4, which is levothyroxine, and a lot of times patients aren't converting to T3. They don't check it. So, you know, every provider is unique, but I would say you really would want to go to someone who has training in the more physiologic forms of hormone replacement, and also has experience working with compounding pharmacies, because you can send any dose, any prescription you want to them, they will make it. So it can be a little overwhelming for a new provider to get into this field if they don't have the training and experience, because it's all on you. You know, it's not there's a standard dose at Walgreens, go pick it up tomorrow. No, you're the one making the call. So it takes time, it takes training, and you know, I've been doing it for 6 years now, and I'm still learning, you know, all the time. And that's the exciting, you know, thing about this field is it's sort of a journey, it's a process. The more you learn, like I mentioned before, the more you can help yourself and help others. So it's something I'm really passionate about. And, you know, a lot of it actually came from my own mom. I don't know if I've told you guys this, but my mom had low thyroid. And she actually struggled with the classic symptoms of low thyroid for like over a decade. And I remember this when I was a child. She, you know, she was tired, she's always sleeping, she's gaining weight, her hair's falling out, she's constipated, she's even depressed, like all the classic symptoms of low thyroid. And all of her doctors would say, your thyroid's normal, you're on levothyroxine, it's working well, your TSH and your total T4 are fine, it's not your thyroid. And they would just not, you know, they didn't know what other tests to do, they didn't know how to help her.
Yeah.
Yeah, they just said, we don't want to discuss it. It's not your thyroid. Just don't even, we're not addressing it. And this was in the Valley. This was in Arizona. So she went to probably 10 different doctors, endocrinologists, you know, specialists, naturopaths. No one was able to help her. Finally, she encountered a provider who was trained in hormone replacement therapy, checked the free T3 level, and found she wasn't converting over to she wasn't converting that T4 over to T3. So they switched her to a natural desiccated thyroid. It was actually Armour thyroid. And within, I would say, the first about like, you know, month and a half, all of her symptoms started resolving, and once her hormones were fully balanced, she was fine. And she had to suffer with these issues for over a decade. So I think just me having seen her go through that, and like her telling me like how much she suffered and how, you know, she feels just it was a life-changing difference. It's almost like maybe I was, you know, meant to go into this field just because her having gone through that. I don't want patients to have to deal with that. So that's why I think it's important. Just, you know, it's great. There are webinars like this. There's so much information on the internet now where patients can almost educate themselves and be, you know, more proactive and ask these tough questions to their providers. Yeah, and if they're not willing to check a free T3 or even consider natural desiccated thyroid, you know, you really oftentimes have to be almost your own advocate at this point and find someone that has the right training, or else you're just going to suffer and not have a good quality of life.
No, absolutely, absolutely. So, out of curiosity, what is the cost of going to like a clinic like yourself there? Like, what's the usual investment for someone?
So with PrimeBody, we actually do an initial consultation for free. It's complimentary, just so that we can talk with the patient, determine if they're a candidate, can we help them at all. So the initial consultation is complimentary. The blood panel, we typically send patients through LabCorp, and the cost of the full hormonal panel for women is around $78. So it's under $80. And then after that, once we come up with the program, it's basically, at least the way our clinic does it, is a monthly subscription-based fee. So each month, it's covering your office visits, any patient management, all of the prescription medication, shipping to your own home or office. So you kind of know each month this is going to be the price that covers everything. So you don't have to worry, am I going to get charged again for my office visit next month, you know, and how much are the prescriptions going to cost, you know, next month. It just, you know, it's a set price. So it just ranges based on how many hormones a patient needs. Starting out is around $150 a month, and that would be for one hormone, and then up through around a couple $100s a month, just depending on how many hormones a patient needs. And that would be whatever dose is appropriate for the patient. So you don't have to worry if we're changing the doses over time, is the cost going to change? It doesn't. So at least that's the way our clinic deals with it. And that's also because we really don't do any billing of insurance at all, only because this is considered more, you know, preventative wellness service. I tend to always say we don't really have health care or health insurance. We more have sick care or disease care. Like if you're sick, yeah, if you're sick and you're diseased, then you go to the doctor, you can get your prescription, that's covered. If you're doing this to be more preventative and wellness oriented, typically insurance wouldn't reimburse for it, so we don't do any insurance billing. But I have some patients using like their flex spending accounts or HSA account, so that's sort of like pre-tax money, which can help with some of the cost.
Is it where, I'm sorry, is it where people have to go in physically and visit your clinic, or is it telemedicine?
We do require an initial face-to-face visit with one of our providers, and we're in multiple cities throughout the country, so most likely we'll be in the state that a patient lives in. If not, PrimeBody does provide travel reimbursement for that, the face-to-face visits, but at least a face-to-face visit once a year would be required. The follow-ups could be through telemedicine, and only because we're dealing with a controlled substance in most cases, testosterone. We just feel that we should establish that face-to-face relationship.
You don't have to answer this, but why is testosterone a controlled substance again? Okay, hold on. We actually have a really good question here. I just want to read it to you. So it says, do you suggest a certain blood test for women, such as on Nelson's company's discountedlabs.com, the female anti-aging blood test, or should you test independently and separately for estrogen, progesterone, testosterone, and thyroid?
Well, Nelson, if you know what's on your panel, I could tell you if that's everything, or I could just let you know which lab.
It's pretty much that. It's pretty much what you said. Progesterone, estrogen, testosterone. Which one am I? And free T3 and TSH.
Perfect. Yeah, so that's exactly what I recommend. Like, if you want a little more specifics, like definitely you'd want like estradiol would be the dominant form of estrogen you want to check. Progesterone, the test is just called progesterone. Testosterone, I do like to look at free testosterone levels in particular. Most of the time, probably on your panel, you'll see free and total, but it's almost more important diagnostically to look at the free testosterone, because sex hormone binding globulin is actually oftentimes a lot higher in women, especially on oral contraceptive pills. It's very high, so it binds up a large portion of that total testosterone. So looking at the free gives you a better picture of what's actually available for the body to use. And then thyroid, I do like to look at TSH initially. Not that I obsess over that when I'm treating a patient, but a TSH, and definitely you said, free T3 is very important. You can even add on thyroid antibodies. You don't have to do that, but if there's a family history of Hashimoto's, or you want to know, exactly what's the cause, antibodies can be added on. So those would be the main ones. And then, like I mentioned in the beginning, if you really want to take a look at the full hormonal cascade and even adrenal functioning, you could add on tests like DHEA, pregnenolone, cortisol. I know pregnenolone can be pretty expensive, but if you really want that full picture, you could include all of those. But the basics, like Nelson mentioned, estrogen, progesterone, testosterone free and total, and then the thyroid, including the free T3.
Go ahead, Nelson.
We still have a few minutes. Do you want to expand on cortisol, or is that, cortisol is so controversial, and on testing and treatment, Allison, or is that something?
Yeah, I would say maybe that's something for another webinar. And even talking about thyroid with all this, that could be a whole webinar by itself,
Yeah.
So.
We have a lot of topics. We have a lot of topics to cover with you.
Yeah, I think it's a great idea, Nelson. I really do think, by the way, Allison, you've been phenomenal on this show. I mean, the information that's been coming out, I'm kind of blown away. So that actually speaks to my question. What are you, and I know we're coming up on 5 o'clock, so before I ask my question, we've got about 7 or 8 people that looks like coming on and off watching this, based on Google. If you guys have any questions, please type in the group chat. Any other questions for Allison before we end this? We're probably going to be on for another 5 or 6 minutes. So my question is, there's so many different hormones, and obviously men and women are very similar, but for men, it's usually a management of testosterone and estrogen, and the process that it entails. And yes, we are looking at other hormones, and yes, we are looking at other blood ranges and whatnot. But it seems like for women, and again, correct me if I'm wrong, and then allow me to ask a deeper question. It seems like it's a lot harder to balance everything and get a woman dialed in from a perspective of, let's say a woman comes to you, she's 40 years old, I'm giving you a hypothetical patient, and she has never been on hormone replacement before, and she wants to lose body fat, and she most likely has, as she said, 2 or 3 kids, she most likely has a not optimal thyroid level or a dysfunctional thyroid level. How long on average would it take a woman to get quote-unquote dialed in and balanced out and have her hormones optimized if they work with, say, you or PrimeBody? And then compare that to an average endocrinologist or general practitioner who's doing hormone optimization with women across, let's say, North America.
Yeah, that's a great question. So I always explain to my new patients in their consultation that balancing hormones is really, it's a process that we cannot rush. If I try to rush it and give them excessively high doses, or I'm too aggressive just because I want to see that end result, tomorrow, they're going to end up having side effects, having issues, and probably stopping therapy. So I always just tell them, you need to be committed to this. Work with me. I'll work with you. We're going to start moderate doses. We're going to increase them based on your response and your lab results. So it's definitely a process. And I would say average, probably around 3 months, some patients up to 6 months, to get them perfectly dialed in. They're going to start seeing initial benefits for sure in the first month, but to get them perfectly dialed in, I would tell them, give it this full 3 to 6 months to get you perfectly, balanced. And then you have to compare it to other specialists like, family practice or endocrinology. I mean, they may never get someone balanced.
Right.
So looking at, a 3-month process to someone that's never going to get you balanced, I mean, you just really can't rush it. You can't be too aggressive with it. Every woman is different. Everyone responds differently.
Right.
And so you just have to take it slow, and you can always increase the dose with time. It's not a race. We're not in a rush. We have time, but most often women start seeing some noticeable benefits within the first, oftentimes 3 to 4 weeks of starting. So that's just encouraging to see some improvement, and then just know it's going to keep getting better as we get, her closer and closer to her perfect balance. And it changes over time too, as a woman transitions, later in life and gets, closer through menopause or past menopause. We're changing the doses, so it's not like you're going to be on the same dose for the rest of your life. Maybe if you're postmenopausal, yes, but most women, it's sort of like reevaluate and make adjustments based on her body and how she is responding. So definitely cannot rush the process.
Awesome. Great answer. So real quick, we're right up at 5 o'clock. We haven't had any other questions come in. Nelson, if you have some questions that you want to get answered real quick.
And let me let's talk a little bit about logistics more than anything. This video obviously is being uploaded right now to YouTube. It'll be available on your website, you guys. And why don't you tell people? It's probably the first video they've watched of you guys.
Awesome. So Allison, that's what I was just going to say. So tell us a little bit about how people who will be eventually watching this video, and I'll of course link to it. Nelson will link to it. But how can people work with you and PrimeBody?
Yeah, I would say the best way would be to check out our website. It's really easy to remember. It's PrimeBody.com, and then that will have our phone number and email, so patients can get in touch with our administrative team. So they'll definitely go through the administrative team, and then they'll let them know, okay, where do you live? They'll let them know which provider is closest to them, and then get them set up to have blood work done in their initial consult. So definitely, going to the website would have all of that information on how to get in touch. But the email is pretty easy too. It's just info@primebody.com. So that's pretty easy to remember.
Awesome. And then for a lot of the ladies that will be watching this too, Nelson started an awesome discussion group on Facebook for women's hormonal replacement therapy and women's hormonal health, and there's not enough women in that group. I don't know why we can't get more women to take advantage of it, because there's some really strong thought leaders in there. So we'll post a link to that. Is there, Allison, any other books or resources? Obviously Nelson's site, Excel Male, I know he has some stuff in there about women's stuff, but is there any sites or books or resources that you would recommend that women check out?
I'm actually on Nelson's Facebook group as well, and I try to, as often as I can, go in there and look at the questions, and there's great articles posted there. There are also some videos that I've done about what we just covered, and they're posted on PrimeBody's website. So definitely go to the website. You can see some videos, and then Nelson's Facebook page is great, and yeah, I would say definitely start there. But there's much more detailed videos about the things that we just covered. There's one all about testosterone in women. There's one about physiologic, like estrogen, progesterone, synthetic versus natural hormones. So those would be worth checking out as well, and they're on the website.
Awesome.
My Facebook group is called Women's Health and HRT. Women's Health and HRT. You can find it by just typing that on the search box on top of the Facebook page. Women's Health and HRT. All right.
And I would encourage every woman out there, women or men, to take responsibility for your own health. Seriously, guys, if you don't take responsibility for it, do not put it in the hands of the healthcare system, because you'll just be a number.
Right.
You will definitely, you'll regret it, and you will wish that you took your health seriously, because until you have sickness, you truly do not appreciate your great health. And I've seen it firsthand. So please do what you can, do the research, know your body. And ask questions, because when you ask questions, you truly learn. And that's why Nelson, I mean, you guys, Nelson is an amazing person. He has years of research involving all of this. And he has a free Facebook page out there to help people that people aren't even participating in.
Right.
So wake up.
I don't know.
Wake up.
It's my bad. I don't promote well, so we don't have marketing.
No, that's definitely not
No,
true.
I'm just saying, people, wake the F up before you have to pay attention.
Yeah.
That's it. I'm out.
Okay. Well, listen, Allison, again, man, we really, really, truly appreciate you coming on the show. We're definitely going to have you back. I think that, like you said, the thyroid issue is paramount. Way too many women are suffering, and not enough people are informed. And obviously, you speak at an incredibly high level. So we'll set something up. I'd say probably this summer. I'd like to have you back on again, and we'll promote the living hell out of this this hangout. So again, for everybody who's watching, we appreciate you guys watching. This will be live on Google or on YouTube, and then we'll also post on our blog, which is fabbitover40.com. And then Nelson, you have final words, but remember Nelson's site, excelmail.com. There's tons of information, and of course we encourage all the men out there, and the ladies too, to buy both of our books, because they're also very awesome resources on TRT and hormonal optimization.
Yeah.
Amen.
Thank you, Allison. You're great. There's a folder on Excel Male called Excel Female. So it's actually a part of Excel Male. I need to create one specifically for women, a whole website, but there is a section on Excel Male for females, because a lot of the guys on my side, there are over 12,000, are getting on TRT, on testosterone replacement, feeling better. And then obviously their women may or may not be interested in their higher sex drive.
Right.
The conversation starts there. So it's either one partner bringing the other one into this progressive preventative field. That's what I see. Either the female, the woman gets it first, she feels better, she's losing weight, then she talks to her partner, and vice versa. So that's why I think men and women should know about male and female health, because we all obviously have partners that we can change our lives too. So thank you, Allison. Thank you, Monica. Thank you, Jay. And thank you, everybody. And look for our next one maybe in 3 weeks.
So we're going to have Sean Norian, the owner of Empower Pharmacy, to talk about the compounding business, the compounding pharmacy industry, and the business and the changes. It's going to be a really power-packed, information-packed event, and we're excited to have it. So more marketing on that very soon. But again, thanks for everybody for coming out. I'm going to go ahead and stop the broadcast.
Yeah, real quick. Nelson, thank you for all you do. Allison, thank you so much. We appreciate it.
Awesome.
Thanks
okay,
a lot.
guys.